Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Dr. Ryniec, welcome to the show.
Thank you. It's really great to be here and chatting with you.
I'm so excited to have you. Like I said, I have followed you for a really long time. And when I began to dip my toes into the reproductive realm on the podcast, you immediately came to mind. You were one of my first asks. I'm really excited to have you on too. And I think that these first few episodes are really crucial to setting the stage for what we understand about our bodies and reproduction. Before we started recording, I was telling you that I actually don't think a lot of people really know and understand about reproduction. We kind of were taught what we were in high school, but other than that, you had to seek it out, or it was your specialty. You became a doctor. I don't know. I guess there's a lot of people that work with reproduction, but your general person, I don't think, has a good foundation. I am included in that. So today's episode, I know, is going to be super fun. Before we dive too far into actual sperm quality and what we can do about it, could you really start us on first defining what sperm quality means, and then tell us what we need to know when we're thinking about evaluating sperm in terms of reproduction?
Sure, yeah. Sperm quality is essentially the function and the look of the sperm, and it is the main thing that we can look at when we're looking at male fertility. We have all of these tests for the egg and the female side of thing, but the sperm and semen analysis is really the only thing we have to look at the male. And a medical history really doesn't give us a lot of information, whereas when we're talking to women, if they have abnormal periods or anything like that, you can get an idea in your head, oh, maybe something's going on. But male can be totally healthy and not have any suspicion of anything being abnormal, and the sperm can be totally wacky. It's really the best and only test we have for initial screening of male fertility. And sperm quality basically is whether or not that sperm or that person will be able to help or become pregnant with their partner or whatever. And it's a test of the function, also the way that it looks, basically how it's going to work.
Okay, I want to dive more into that because a sperm has a head and a tail, but I've learned on your Instagram they can have two heads, they can have two tails, they can have two heads, two tails, they can have all sorts of things. It impacts the way that they move and the way that they're able to navigate things. Talk to us about that. What's a normal sperm look like and do versus what are the variations we can see?
Yeah, absolutely. So the more important pieces of the semen analysis and the sperm test would be the count, so the number of sperm, and the motility, the movement of sperm. We do always look at the shape and the morphology, but little known fact, actually the vast majority of sperm that are produced are abnormal. So when we look at the shape of sperm, a normal test, there's different kind of scales for it, but a normal test is typically 4% of the sperm have to appear normal to be a normal semen analysis. And so that means 96% of sperm can be this double-headed or double-tailed. As you said, there's a head, there's a neck piece, and then there's a tail. And because sperm is just typically mass produced, there's just a ton of error. And really any combination of abnormal is something you can see. So there's double-headed, double tail, There's big heads, small heads, pin heads. There's like spiral tails. So there's a bunch of different abnormal sperm that's being made, even in a normal semen analysis.
So do you think that accounts, I know genetics obviously account for a lot of it, but do you think that accounts for some of our differences? That does that actually go on and not impact the egg or the person, but just influence it in some way?
Most likely not, because those sperm probably are not the ones that ultimately fertilize the egg. But maybe it'll be a cool or nice thought that that could happen. Like maybe one that's like spiraling really fast is someone who's really like chaotic and crazy
Yeah, or
through
like
their
our
day.
really
But
fast athletes all came
yeah,
from a sperm with a
yeah.
curved out. That's hilarious.
But
That would be so
probably not.
funny.
That's just would be a fun thing, but I don't think true.
Not how that works. Yeah.
Yeah.
Okay, cool. Okay, can you break down a couple of the terms that you just used? Motility, morphology, mobility. What do we need to know about those things in sperm?
So when you do a semen analysis, you're going to get a whole bunch of information. So like the pH, the volume is how much total ejaculate there is. So the sperm plus all of the fluid that it comes in. pH is where it falls on the acidity or basic scale. There's also a whole bunch of other things like agglutination, like how sticky it is and the viscosity. But really, when it comes down to it, the things that I'm looking at are the count or the concentration. So the count is the number of sperm, so the total number of sperm that is seen in the certain area of the semen analysis test. The concentration is a little bit different. That's the amount per milliliter of sperm. So that's the count divided by the volume. Oftentimes it's used interchangeable, but if you look at the units of the result, that'll tell you whether it's a count or concentration, which is important because they have different cutoffs for normal, whether it's a concentration or a count. You can use both, but it's important to know which one you're looking at. And then the motility is the way the sperm is moving. Usually it's total motility that we're interested in, and that's usually defined in a percentage, a percent of the number of sperm that we're counting that are moving forward. But they also sometimes will break it down. This one's a forward progression. This one is moving, but it's maybe going in circles or something like that. And then sometimes they'll also break it down by speed. But the most important thing is the motility itself.
All right, nice. Okay, I feel like we've got a good foundation. I do have a question. I can't stop thinking about these variations. So, if 96% or so of sperm is a variation or a form of a variation, two questions. Has it always been like that? And B, is there anything that's causing that? Why just 4%? Is that normal? Is that what it's always been?
So I think the answer is mainly just that when they look at semen analyses and compare it to people who are then able to conceive, get pregnant or not,
Got it.
they see that 4% in this one kind of grading. There's other grading that it's 12%, but it's less strict. So 4% is kind of like the strict grading system. People with 4% cutoff in general are still able to conceive. Morphology is a little bit of an interesting piece of the semen analysis in general, because it has been shown that if the motility and the count are normal, even if the morphology is very low, it typically doesn't impact fertility in the same way. Like when I see
Wow.
patients and it's just the morphology being abnormal, I don't typically say that's the reason why you haven't gotten pregnant, unless it's all head defects. So if 100% of the abnormalities are head defects, then we know that can cause a problem, because that's how the sperm fertilizes the egg, with the head. The other parts of morphology is that whereas count and motility are like calculated and objective, like you're sitting there and clicking your thumb, okay, this is how many I'm seeing in this little square. Morphology is really subjective. So it's okay, that head looks too big to me. And so different labs have different like strictness. And so that one's really hard to apply across the board as well. I know our lab where I work is very strict. And so I almost always see low morphology on paper that functionally isn't actually a problem.
Wow. The human body is the coolest thing ever. Like every single little facet of our body that I start to explore and learn more about, I'm like, wow, like our bodies just are so cool.
Yeah.
Okay, you mentioned concentration of sperm or maybe count. I think we're talking about concentration and it's the count. how much count is in the volume of the full ejaculate. Is that right? Did I get that
Essentially,
right?
yeah. Or the count per milliliter.
Per
So,
milliliter, sure. So
yeah.
I guess my question is, you can have something that appears like a lot of ejaculate, a good normal amount, but then when you get in there, there's actually very low sperm count.
In a way, yes. So like you can see that if a concentration is low, it might be more of a large ejaculate volume issue because the count is divided by a larger number.
Mm.
But the count might still look normal. So that's where the difference comes in there. So like the absolute count is what it is. But then when you divide it by the volume of the sperm, and there's different things that can cause higher volume in the sperm or lower volume, it typically is more of an issue. So that's where the difference is there. But again, in the most part, we use them pretty interchangeably. And all that other stuff that comes along with the semen analysis report, like the agglutination, the viscosity, the pH, there's like fructose levels and things like that. They're not as much paid attention to if it's normal, because those are really more in helping like where the defect might be if there is a problem.
Wow, so fascinating. Okay, who should be having their sperm evaluated if we kind of don't know what's in there and unless we have it evaluated? Who should be doing these kind of tests?
Yeah, so certainly I think it's very important to start with a semen analysis right from the beginning of evaluating an infertile couple or a couple with infertility, rather. A lot of times we'll see people and they want to do it stepwise, but really the semen analysis is part of the first wave of evaluation, in my opinion. And in fact, if I had to pick one test, it would be the semen analysis because, like I said, we can get a lot from the woman's history, but we can't get a lot from the male history because could be totally fine and then the sperm can be abnormal. If someone's been trying to conceive or having regular unprotected intercourse for a year or more, that would be an indication. If you're over 35, then it's actually after 6 months. And then there's other reasons too. If someone wants to do fertility preservation, someone might do a semen analysis. You don't hear about sperm freezing as much as you hear about egg freezing, I think, but a lot of people do that. And then other reasons, if you're doing sperm donation, obviously you're going to need to do a semen analysis, or if you're doing fertility treatment for another reason, you would need to do that too.
Oh my gosh, there's so many episodes I have to cover. I'm learning so much. This is incredible. I've never heard of sperm freezing, but I guess it makes so much sense. Okay, one thing that you said perked up my ears. You said that there was a health discrepancy in the fact that, or you mentioned it a couple times now, that we can get a lot from the woman's history, but not a lot from the man's history. Why is that? Is sperm just made so frequently that what they did 6 months ago doesn't exactly matter, where we know that women are born with all of our eggs? Does that have to do with it?
So it does in a way, and I think it's important to note when I say that it's in one direction. So if someone comes and they have medical issues, so like they have diabetes or obesity or something like that, that we know can impact the sperm, then sometimes we can think ahead of time. Or if someone's a smoker or has lifestyle factors that could be adjusted, we can think about that. And then there's things that are more associated with abnormal sperm. So like a history of an undescended testicle or inguinal hernia repairs, pretty bad testicular trauma or masses in the testicle. Like those things I could say, okay, maybe there will be an abnormality in the sperm. But when it's the other side and someone comes and they're like, I'm young, I'm healthy, you can't necessarily say, okay, that means your sperm is going to be normal, because it could be abnormal without having any outward signs. Whereas for the woman, a lot of times, not always, but a lot of times, if the period is irregular, you can already know something's not normal. So you can get a lot more from the history if it is abnormal from that side of things.
Yeah, that makes a lot of sense. Okay, and then I was interested to hear that men over 35, I knew that was the cutoff for women, so it makes sense. But also, growing up, I've always heard that men can have babies so late in age, where women, there's much more of a cutoff. Talk to us about that. Do sperm not kind of age with us like our eggs do?
So sperm definitely doesn't age in the same way. And so when I say 35, really, it is more recommended the female age over 35. We do have some new evidence that over 40 to 45, there can be impacts on the sperm. And so now we have an advanced paternal age in the same way we have an advanced maternal age, which is all terms that I hate, but there are impacts there. But realistically, I had an educator once say, like, men are going to make sperm until they're sick or until the day that they die. Whereas women, like you said, are born with all of the eggs that they're going to have. And so it's a very different situation. They've calculated out based on the number of sperm that men make in like a 24-hour period that it can be like 1,200 to 1,300 sperm per heartbeat. So they are
Oh
literally just
my.
doing it all day long if they don't have any sperm defects.
Okay, and what's a normal amount of sperm? We just talked about like how much they can be making. What kind of variations do we see in that?
Yeah, so the typical count normal is over 39 million. And like I said, the normals on the semen analysis are really like below that is where we start seeing impacts of the sperm on ability to conceive. But I see numbers much, much higher than that. A lot of times it's 60 to 200 million sperm count in one specimen. I've seen much higher than that too. So there's a big range when it comes to normal, since the normals are like the cutoff low value.
And when you do a sperm analysis, is it just one sample or are you taking multiple samples over a certain period of time?
It's one sample.
You get all that information from just one sample. And is that the only test that a male would need throughout fertility?
That's typically the initial screening test. There are more specialized sperm tests, like something called sperm DNA fragmentation that can show potential damage to the sperm. That's debatable whether it's helpful or not. The literature on that is really mixed, but the semen analysis is really the one good test. And then once you have a semen analysis, if it's abnormal, there might be tests that would be beneficial, like their hormones, so FSH, testosterone, even estrogen, screening for things like diabetes, thyroid disease, elevated prolactin, and then potentially a testicular ultrasound and an exam, which typically I'm referring to a urologist trained in male fertility for those exams.
Yeah. Okay. That all makes so much sense. I had no idea that happened. That's insane. Although when you were talking, I was like, man, this seems so one-sided. Women are poked and prodded and constantly tested and constantly come in and having to come in and evaluated and ultrasound and all the things. And they get one sample and maybe a blood draw.
Yeah.
What the heck is that about?
I know it's tough and we make jokes about it all the time. And even if it's a male factor, it's often more the female partner that has more treatment to go through. And I think that's probably difficult on the men in a different way where they're having to support their partner, hopefully through the process. But does feel that way for sure.
Yeah, it definitely feels woman heavy. What is that about? Okay, a question that I got a lot from our listeners was about taking care of your testicles. Something that came up so much, hot baths, hot tubs, wearing too tight of underwear. I know that I think people are generally aware of the temperature taboo when it comes to sperm quality. Talk to
Mhm.
us about what we need to know in terms of heat and our lifestyle, working out, vacationing, hygiene.
Yeah, so I think in general, I'm not typically telling people who aren't actively trying to conceive or telling people from a fertility future standpoint, you can't be doing these things, because a lot of times, because they're making sperm all the time, it won't have a long-term impact. And so certainly if I'm seeing someone that has an abnormal semen analysis or has infertility, even without an abnormal semen analysis, I'm telling them to avoid those things, because the testicles are outside of the body, essentially. They hang lower than the core. And so the temperature is a little bit lower for sperm to function. And so if you're taking a lot of hot baths, hot tubs, tight underwear, bicycling a lot, then you're heating that up. And so it can impact the sperm. And so if someone's coming to me with infertility or an abnormal semen analysis, I'm telling to cut those things out. But I wouldn't tell a high school student or a college student, don't do these things because you're going to impact your chance to have children later on.
And when you say bicycling, does that include stationary bikes,
Mhm.
exercise bikes?
Yep.
Yeah.
Yep.
Wow. And it has
And
to do with the heat, not necessarily that you're sitting on them, right?
yeah, it's a combination, but it would mainly be the heat because it's in a confined area and often tight pants while you're doing that.
And you're getting
Um,
hot, your body temperature is
yeah.
raising as well.
Yep.
Wow. Oh my gosh, I didn't even know that. Okay, so what about supplements? I think a lot of people think, okay, what can I add to my life to improve sperm quality? And I suppose from a pharmacological standpoint too, are there medications we can put people on to help improve sperm quality if we get the test and it comes back not great?
Sure, yeah. There are some supplements that are associated with some improvement in sperm. In my practice in general, and in my philosophy, I'm not typically someone that says you need to go out and buy all these supplements because one, they're expensive and the evidence is, so for some of
Iffy.
them. And so, like, to me, I think the lifestyle is really the more important piece. But if someone's looking for supplements, um, there's a supplement called coenzyme Q10, which is an antioxidant that can help. There's omega-3 fatty acids, or fish oil, I think is really beneficial. And then there's another supplement of acai, which is like that Brazil berry that's all hot in the acai bowls. And that can be it's a really powerful antioxidant as well. So those things I think are what I typically recommend if someone's looking for something. And then go ahead.
No, sorry. No, please keep going. Go, go.
Yeah, I was going to say from the medication standpoint, because you asked that, certainly if there's a medical issue that's leading to abnormal sperm, so if someone's diabetic, metformin or insulin, whatever is going to help them from that perspective can help. And then if it's truly like a sperm production issue, if it's caused by abnormal hormones, there are medications like Clomid, which a lot of people think of for women, that can help boost sperm production. If it's a genetic abnormality or like an obstruction, then that's not going to help. But there are some meds that can be used like Clomid or HCG injections to help boost the sperm in those situations.
That's amazing. Okay, my question was going to be what would you need antioxidants for?
Antioxidants help keep the cells healthy, and while cells and sperm and eggs and everything are sitting and ready to be used, getting ready to be used, you can have these radical oxygen species is what they're called, and they can be toxic to cells and including sperm and eggs. And so antioxidants help scatter those and help keep the quality.
And so are antioxidants pretty commonly used in fertility cases just because we do want to make sure we like are having clean bodies essentially or as
Yeah,
toxic
I mean,
free as possible?
yeah, absolutely. So those tend to be the supplements that I recommend are antioxidant, anti-inflammatory type things. And I think probably a majority of my colleagues, those are go-tos as well.
Yeah, that makes so much sense. It's so fascinating to see the overlap between female fertility and male fertility in terms of the treatment and the solutions that we have.
Yeah.
Okay, I think my next question comes from the answer that you just gave us. You mentioned briefly lifestyle changes. What should we be doing to maybe improve sperm quality, but maintain it once we get to this lifestyle? What are things that a healthy sperm needs from us?
Yeah. So I usually call it just an overall healthy lifestyle because same way I'm not like pushing supplements on people, like I don't ever say cut out all wheat or cut out all milk. You have people that will tell you that. And to me, unless wheat or milk is like inflammatory to you and you feel like crap, like you have to live your life with infertility. And
Yeah,
so don't have McDonald's every day, but if you go once in a while, it's okay. And so from a diet standpoint, lots of fruits and veggies, avoiding overly processed foods when and if you can. Again, treat yourself every once in a while. It's fine. If there's something that bothers you, if you do have dairy and you feel like crap for 3 days, probably not the best option for you. Lots of water and like whole grains and things like that are what you want to focus on in general. Red meat has a lot of those reactive oxygen species, so you want to maybe avoid that a little bit. But again, you want a steak every once in a while, totally fine too. I am a big fan of bacon, so it would be hard for me to cut
same.
that out. Exercise 150 minutes a week, and it doesn't have to be like sprinting or marathon or anything like that. Limiting alcohol, so like a moderate amount, 4 to 6 drinks a week should be okay. Definitely not smoking. That is impactful in so many ways for fertility, but also overall health. And then cannabis, I would say limiting that too. There is some evidence of impacts on the sperm.
And when you're talking about cannabis impacting the sperm, do we know, because sperm is always being generated, do we know if there is a time frame where it is impactful, or I guess anything along those lines?
Yeah, in general, sperm and eggs are recruited on a 3-month period. So the process from like when a sperm is immature to when it's going to be in the ejaculate is about 3 months. And so typically any changes do take about that long to make an effect.
And that includes any sort of medication, supplement, lifestyle changes as well. We're thinking that
Mhm.
90-day period. So if you're thinking about starting to build your family, this is a good place to start before you do that, much like what we see with women, right? They take the months usually leading up to, okay, we're going to have a baby, to get their bodies right or to get their lifestyle back in order or to implement new things. Cool. Okie dokie. My last question about improving sperm quality is, I think about our food deeper than what you just said about the general food health. Are there any specific superfoods? I see this online sometimes and I don't know whether to be like, run out to the grocery store and buy them, or to roll my eyes and be like, oh, this again. What's your opinion on that? Help clear that up.
Yeah, I said acai, I think, is one of those superfoods and big fan of that. It's hard because when the studies have been done about acai, it's about like super concentrated like supplements. And so whether or not an acai bowl is like going to impact things significantly, hard to know. But I'm a big fan of that. The other superfoods, sure, they're shown to be associated with overall health. They're great to have, but if it's not something that you like or super expensive, it's important to do what's accessible too. I wouldn't say someone needs to go out and be having that stuff every day to make sure that they're going to have a chance to have a child.
Don't be force feeding your partner acai, you guys.
No, no, they're in, right? Like the acai bowls, you see them everywhere, but
I love them. Oh yeah, they're one of my favorites, but I couldn't get my husband to eat one if I paid him. Oh my goodness. Okay, so one of the things that has been most fascinating to me learning from your Instagram is about lubes. Obviously, when it comes to sex, lubes are something that's in every household. One of the things that I hold very important to me is having clean ingredients in the products that my family uses, especially on our body and especially in our intimate parts of our bodies or parts of our bodies that are really mucosal. So, even like our face, our underarms, I'm very picky about those. I was shocked to see you post that lubes in the US have ingredients, a lot of them have ingredients that are actually not sperm friendly. Talk to us about that. What do we need to know? Are there any, I guess, brands that we need to stay away from, or chemicals, ingredients that we definitely want to be aware of when we read the backs of bottles? And then what are these chemicals doing to the sperm?
yeah, it's a little tricky because what works as a good lubrication doesn't necessarily work to support the sperm, right? The benefits of a lubrication are that makes things a little bit more slippery but not too slippery and more comfortable during intimate moments. And those might be very different than what is good for sperm for those that are trying to conceive. The studies on the lubes, it's a little tricky because they leave the sperm in the lubes for a really long time. And so the toxicity is really hard to say. So again, if you're trying to conceive, you want to try to pick a fertility friendly one, especially if you are experiencing infertility, but it doesn't necessarily impact everybody. It's the same as what you're looking for with the other products that you have in your house. Like you said, you want to avoid fragrances, parabens, like glycerol, phthalates, those type of things. Low pH in a lube is not good because the sperm doesn't survive at a low pH. That's like the acidic pH. You want to have it be more like 7 if that's information that you get. Oil-based lubes tend to be a lot more similar to the body, and so those tend to have less impact than silicone-based lubes. and water-based lubes, which you would think water-based lubes would be
Yeah.
like a good option, but it can impact things pretty significantly. I think
Wow.
that what they say is there's like a hydroxycellulose based lube that's the most common or most similar to vaginal mucus. So it's finding something like that, but definitely avoiding the fragrances, parabens, phthalates that we see, unfortunately, in many of our household daily things that we use on our bodies.
Yeah, it's all over. I am hopeful, fingers crossed, that one day in our lifetime, hopefully soon, we'll have some sort of regulations around those types of things, and we
I
we
think
can,
so.
yeah, we can not have to hawkeye all of our products before we purchase them. Okay, I have a question about household items. Speaking of, what about just oils that you have in your home? Not canola oil, but coconut oil, avocado oil, olive oil, oils that people trust to put on their face, maybe not castor oil. Can we use oils around our home? Talk to us about maybe. I think the more crunchy community would be
Yeah.
like, I just want to use the olive oil from the kitchen. I just want to use this oil, but not all oil is obviously made equal. And then I'd love to hear what it does for our sperm.
Yeah. So I would say in general, you want to use natural oils that maybe don't contain as much sugars potentially. Things like avocado and coconut oil may have that. And so that's not super friendly to the vagina. I know people use those or coconut oil based lubes, and that certainly can be okay as long as you're not having processed and cleaned. Olive oil, I know a lot of people use. I in general tend to recommend more towards like the FDA approved like fertility friendly lubes just because we know they've been tested, but that might be an option for people too.
Yeah. What are those FDA approved ones, or where would we find a list?
Google has a really great, that's probably the best, and I always forget off the top of my head. Some of them have like really obvious names. So Pre-Seed is a
Oh,
conception fertility friendly lube. I think the most important thing to know though is like it doesn't necessarily help you conceive. So if you're someone who doesn't need or want to use lubrication, you don't have to use that to help you get pregnant. It's just if you do like to use lube or need to use lube, then those would be the ones you want to look for. So there's Pre-Seed. KY does have a fertility friendly one. I think, like I said, I think there's 7 that are truly FDA approved for that purpose.
sure. Okay. Wow. I had no idea. They're not going to be like go boosters for your sperm, but they're not going to cause any harm.
Correct.
Got it. Okay. And if you think someone is a good candidate for an analysis of their sperm, what would be their next steps? They hear this podcast, they think, oh my goodness, I have a lot of the things that she spoke about. I actually, some of this feels very aligned to me. I would like to get my semen checked out. What are your next steps? Who do you call? Who can help you? How do you find someone in your area?
Yeah, so if you're under the care of a fertility doctor or you want to be under the care of a fertility doctor, you can get evaluated there. And we order semen analyses. We do them in our office. It's part of our bread and butter. I don't typically see men who are just looking to have a sperm evaluation because we don't do sperm freezes here, but some fertility clinics may offer that as a service. Sometimes people will go to their primary care. So I've had people end up seeing me after they saw their primary and had an abnormal semen analysis to go through the results and things like that. And I've also had a lot of people starting with their partner's OBGYN if they have a partner. But if unpartnered and just interested, then a primary care doctor should be able to order a semen analysis for someone. There's also online kits now. They're less good, I think, because you're mailing off the sample. And for example, we want the sample within 30 minutes to really be able to give the best information to someone. So if you're mailing off the semen sample, probably not as ideal as it could be, but there are different mail-in kits, like one is called Legacy, I believe. So that's another option. But I think getting a formal semen analysis is probably going to give better information.
Okay, and how long does sperm live both inside the vagina and also outside of the body like that?
Yeah, so inside the vagina, it's 5 to 7 days, which is why the fertile window is longer than the actual day of ovulation. So if someone has sperm even 5 days before someone ovulates, it usually doesn't last quite as long outside of the body because of the pH, the temperature, and all of that. And even when we're doing semen analyses, if it's been over a couple of hours, we don't typically think that it's going to give us a real look at the sperm.
And what will you see? They really appear to die off and then they just
Yeah.
stop moving?
Yep, they slow down. There's higher number of dead sperm. It just doesn't give us quite the same info. You could probably still get a count because you'll see the dead sperm, but it's just less indicative of the health.
Yeah. Wow, that's crazy. Okay, and when you get an analysis, how long until you get your lab results?
It depends on the clinic. Usually ours result the next day because
Wow.
part of it is like a live look at the sperm, and then part of it is actually killing and staining the sperm for the morphology part of it so that we can really evaluate how the sperm looks. And so typically that happens, and then they look at them the next day, and then we get the morphology score. So usually they'd be available within a day. Um, and it depends on whether they auto-populate into your MyChart app or if you follow up with a doctor to get the results, but they're pretty quickly available.
Yeah, and then you would just discuss that with your provider and move forward with whatever plan.
Yep.
Yeah. Wow. Okay, my last question is about the age of freezing your sperm. Since sperm is always being made until the day that they die, can men just freeze their sperm at 70 and it's just as well as someone who's freezing their sperm at 35? Obviously, keeping space for the age difference because women just, that would never happen with women. Is that a possibility for men? They can freeze their sperm throughout their entire lifespan?
They certainly could. Again, like over 45, there is some new evidence of declining qualities, and it's not as many 70-year-olds that don't have any medical problems that could be impacting things, although there are very healthy 70-year-olds. But essentially, you could. I don't know how many 70-year-olds are wanting to freeze their sperm for whatever purpose, but yeah, you definitely could. But in reality, when I'm thinking about people who might want to sperm freeze, it's if they're going to go through like a medical treatment that they're not sure will impact their sperm. I have trans patients that'll freeze sperm before transitioning or starting estrogen because estrogen will impact the sperm. I also have people freeze sperm if they're going to have a vasectomy, just in case, although that kind of, if it's just in case, you never maybe shouldn't be doing the vasectomy, but, or if starting testosterone, because testosterone will decrease the sperm. And sometimes people would like to freeze it and they want to stay on their testosterone instead of reverse it. Those would be some reasons to think about freezing it.
Got it. Wow, that is also fascinating. Okay. I have a ton more episodes that I have to get out now because I learned so much. Dr. Ryniec, truly, thank you so much for joining us. This was such an insightful conversation. I didn't know very much coming into this conversation, and now I feel like I have at least a foundation of understanding sperm health, what we're looking for, and things that may impact it. If people were interested in the things that you said today, if they were interested in connecting with you, if they're in the New England area and they're interested and they're looking for a fertility doctor, where can people find you to work with you privately and then also online?
Yeah, so I am at CCRM Fertility in Boston, but I see people all over New England and even farther. But the majority of people are within the New England states because they can travel here. So we're just outside of Boston in Chestnut Hill. And I am also online. I do a lot of education and humor on social media because I think it's a good, fun, creative outlet for me. And that is Jessica Ryniec, MD.
All right. Thank you so much for being here. I really appreciate it. You have played a really fun role in building our community's foundation in reproductive health and learning how we can really get our bodies in line with trying to make a baby and build our families. All right, you
Yeah.
guys, I will see you in the next episode. Be sure to follow Dr. Ryniec on social media, and you can find me at Tranquility by HeHe or the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye!